Good afternoon, and thank you for joining us today. Today we have Edgar Villa, Executive Director of Crossroads Recovery Centers. Edgar, thank you for joining us.
Thank you for having me today. Appreciate it.
Crossroads Recovery Centers. Edgar, can you give us a little synopsis of the services that you offer at Crossroads?
We offer an array of services. We offer anywhere from individual therapy all the way to alcohol and drug services, and in between adolescents, families, couples. So we offer all these type of services, anger management, co-occurring disorders, and I'll explain a little bit more what those is. But if you have some need for us, we'll attempt to provide you services. If not, we'll link you to someone or an agency that could help you.
That's terrific. That's terrific. So you talked about the different levels of services that you have at Crossroads, and I understand that the kind of most intensive level is residential treatment. Is that correct?
Yes, residential treatment is the most intensive treatment that we have at this moment, which means that the residents that actually live there, they provide all the food, lodging, all the treatments are in one setting. And we try to create a cohesive group with a lot of education. They wake up early in the morning, and they have treatment throughout the whole day.
Wow, that's amazing. Can you tell me a little bit more about the facility, the residential treatment facility itself? So what does it look like, or what's the kind of feel of the place?
Well, actually, I'm glad you said it, because a lot of individuals have this belief system, which is rightfully correct, is that sometimes these individuals are taken to this 5-star program or agency, and there's a reason why you want to have an environment that's really beautiful, aesthetically, quiet, and that's what we offer. Because one of the reasons is it's actually located in Whittier, and it's a very nice setting. It's spacious rooms. We have a pool. We have nice area where they can actually watch TV and all these different things for them. And it's set up in a way that they don't have to worry about anything else. They only have to worry is about themselves. They don't have to worry about making sure there's holes or something wrong. So they can totally immerse themselves in the recovery process. So that's some of the physical aspects when it comes to our treatment center.
That's terrific. That's terrific. And you talked about everything's provided for them. So you said they're cooking also, and meals and everything like that is provided as well?
Yes, we want them to focus just specifically on their treatment. So we do have someone that comes in and provides breakfast, snacks, lunch, and dinner.
Oh, that's terrific. So can you tell me what a day in a residential treatment facility looks like, what it consists of?
Yeah. A lot of people think, well, they're going to this nice place, they're going to this environment where it's quiet, don't have to clean, someone cooks for them. Wow, I want to go there.
I know, right? Sounds like a vacation.
It sounds like a vacation, but it's not a vacation. Think of this is their job. 24/7, 40 hours a week, they're going to be doing treatment. They go from one meeting at 7 o'clock in the morning all the way up sometime until 8 or 9 o'clock. So they're constantly working, and then they're doing a very difficult job, which is taking a look at themselves, understanding what they did, what they're not doing, how they ruined their relationships, so how they could improve their relationships. So it's a really difficult process. And imagine if you're going through this process in an environment where it wasn't aesthetically pleasing. I mean, it's not definitely needed, but it will give you a sense of comfort. At least you go into your room and it's nice and clean, and you could work on yourself, contemplating yourself without a distraction of something else. So that's kind of what we do. So when you think of a treatment center residential, think of it as work. They're working, they're putting all their time and effort into this, and we make sure they do.
That's amazing. So they're going from 7 in the morning till 9 at night?
Yes.
Wow, that's pretty intense. That definitely seems like they'd get through whatever they were going through. And how long is that process typically? Is 30 days, 60 days, 90 days? What are people usually there for? What length of time?
It varies. Some of us will be there for 30 days. Some people will be there for 60, 90 days. Well, it varies whatever they're willing to do, their insurance pays. So there's different reasons, and studies have shown that typically 6 months or longer in treatment is what's the most effective. So we try to tailor. However, we have to understand that not everyone needs intensive residential for 6 months at a time. So we're looking at it's like a step down process where they start a residential, and some of them just come into our detox facility and then transition to a residential. So typically the process is looking anywhere between maybe 60, 90 to maybe 6 months to a year, depending on the particular situation, individual cycle, social aspects of the individual.
Interesting. And your staff at Crossroads, can you tell me a little bit about your staff and their experience, what they have to offer?
Yes, our staff actually has a simulation of possibly, I believe, like 25 years or more in providing services, mental health and substance abuse. And right now, our therapists, they're certified for alcohol counselors and also do therapy. So think of it this way: they don't have to see two different people to get different services. However, we do have specialists that only specialize in that, and that's what they're going to be doing. However, we do have a variety of individuals there that are able to provide both services if needed. Because imagine you go to therapy and all of a sudden you say, okay, you have to do alcohol withdrawal counseling, and you have to do it with a totally different person, which is okay, and that's typically the standard treatment. But imagine you have your therapist or counselor who could do both for you, and your therapist and counselor will know which mode to actually use or which type of treatment to provide you at that particular moment. Because sometimes I'm providing services, I'll stop doing individual therapy and focus on alcohol withdrawal counseling, and I could switch back and forth. Mm-hmm.
Interesting, interesting. And you talked about detox. Mm-hmm. So a detox, can you tell me a little bit about what that consists of? Because I'm not really sure. Detox, it just sounds to me like somebody's going to go in because they're using some type of drug to get clean. So is that any type of drug? Is that alcohol, or what exactly? Who needs detox?
Well, detoxification services that we provide are two different levels of care. It's a recovery model, which means they don't really need medication services. They just need an environment that is drug-free, that's going to encourage and support that detoxification process. Now, what happens is maybe an individual's been using alcohol for quite a while and they need some medication-assisted detox. Mm-hmm. And then when we have a psychiatrist which follows medical protocols to detoxify a client, that's what we're doing. So it's someone that's coming in and has been using, and they need some assistance to be able to completely rid of themselves internally of the alcohol or other drugs. And the second part of your question was which type of drugs, any type of drug. Typically what we really need detoxification for is for alcohol, benzodiazepines with the Xanax, Valium, those medications, because they have a really intense withdrawal symptom. You could have seizures and whatnot. Also sometimes the heroin really needs a lot of help because you have a lot of physical withdrawals. And so any type of drug that you need detoxification for, we could help you with. However, if the criteria is too much, they have co-occurring medical conditions that they need medical attention, then we will link them or take them to a medical facility that could detoxify them, just in case. We want to be as safe as possible, making sure that our clients detox successfully, because that will determine they'll continue into residential treatment. And that's what we want to do. Detox is like the beginning point where we're trying to encourage them to actually take the next step, which is residential. And then eventually residential, take them down to day treatment or intensive outpatient clinic. So that's what we're doing. We're attempting to, every point that we get our client, whether at detox, residential, IOP, that we provide them services, the service that they need and the level of the care that they need at the moment.
That's terrific. So you really do tailor to each individual and the service that they need necessary to make them successful with their treatment, and that's amazing. So I just keep thinking in my head, 7 a.m. to 9 at night. I mean, it sounds like an intensive work schedule. Is it all just nonstop meetings, thinking? I mean, is it really that intense?
No, they get breaks to eat.
Okay.
No, well, all fun set aside, it actually, you need an emotional break. You do need a psychological break. So I'll give you a specific rundown of our meeting schedule. So say they wake up at 6 o'clock in the morning, they might do at a total meeting, or they might do some type of meeting for themselves. And then what happens is that after that, they eat their breakfast. They might take a 30-minute break. Then like around 8:30, they have another meeting. And then once it's usually a meeting's an hour and a half, depending on the day and who's conducting the meeting. And then after that, what we have them do is do some physical activity, either take them to the gym or have them do something they're active. Once active, they come back, of course, have to bathe or whatnot. Then they get their lunch. Then they have 30 minutes either to do their homework or just relax, make sure everything's tying up. Then they do another meeting, and for an hour and a half, they take another break. And depending on the day, they'll do another meeting before dinner, or maybe just have a break or see an individual therapy or individual counselor. And then after maybe 6:30, they will be either taken to an outside 12-step meeting or a meeting that's of their need. And the reason we do that is because studies have also shown that if you have a community involvement, if you have the extra support from 12-step meetings, your ability to sustain long-term sobriety increase significantly. So we also incorporate that. And after they either come back with a meeting, They have some snacks, and then they do a checkout meeting, just kind of process the whole day, how it was for them, and take an inventory, getting the behavior, taking an inventory. Am I moving towards recovery, or am I moving towards relapse? And having become that conscious awareness, because the brain does change during the addiction process, where you have to make that unconscious craving that gets activated to a more conscious response, and that takes a lot of work. It takes a lot of ability to understand, okay, this is what's going on with me. I have these triggers. In order to make that transition over and make a conscious decision, I'm just not acting the automatic pilot. I am actually in the driver's seat this time.
It sounds really empowering. That's terrific. So also, Edgar, when you were talking about kind of their day in the support system, so for these 30, 60, 90 days, 6 months, or however long they stay in treatment, their support, do they also get to seek support from their family, friends? Do they have contact with them?
Yeah, sometimes they want to see them the next day. However, we understand that some individuals that we had come up from a family system that doesn't really approve or doesn't support their sobriety, or maybe contributes to their addiction process. So it's an individual basis. We have a standard protocol where we encourage them to get support, but at the same time stay away for 2-3 weeks while they're emerging into the treatment process. But studies have shown that family involvement increases the possibility or the probability of them actually sustaining long-term sobriety. So we encourage them. But at the same time, as the families are waiting, we don't want them to wait there and not see their individual talk to someone.
Right.
We want them also themselves to go through this educational process. Make sure they're aware of what they're doing, what they're not doing, how to support their individuals, and what to say and what not to say, and how to say it. Because think of it this way, this dance they're going, right? They want to change this dance, but the music has also changed in between. The music changes, which is the addiction changes, communication changes, so now they have to learn to dance a different dance. And you have to stop that and help them, and maybe stay a few steps. So we have to educate the family. So if the family comes on board, we recommend it. We do either phone sessions, we either bring them on site, or maybe see them somewhere else. So that's we try to bring in the family involvement, try to get them to get a sponsor involvement. We try to do as much support. We try to replace the old behaviors, old support systems with new ones.
That's terrific. I really like that metaphor, kind of the new dance that they're learning to do together. I really like the way you phrased that. So you also mentioned something about I'm sorry, you also mentioned something about a psychiatrist. Is the psychiatrist there at the residential facility, or what role does a psychiatrist play there?
The role of psychiatrist that she plays is that she serves as a consultant. She might see the clients. It varies what the client needs. So she might stop by, she might see the client, she might do a phone consultation. Her role is to make sure that we do have a dual diagnosed client or co-occurring client, which simply just means an individual that has a substance use problem, and then they also have maybe depression, anxiety, or bipolar disorder, or something like that. And she's actually going to help us with the co-occurring disorder, with the depression, with the anxiety, with the bipolar, to make sure that the individual is medically assisted in that process. Because some depression, some extremely severe depression would benefit from actually having a medication that will help them transition to that, through sobriety.
Okay, interesting. So it sounds like your residential facility really has kind of all the bells and whistles and everything that somebody going through an addiction would benefit from. But again, who would qualify? How do I know if I have somebody that I believe faces an addiction for alcohol or drugs? How do I know that they belong in a residential treatment facility versus going to your outpatient groups or individual counseling, things like that?
So good point. So the question I get that asked a lot is the level of care.
Correct.
Who qualifies for residential, qualifies for IOP? To be honest with you, you need to call us and give us more information to be able to assist you a little bit more. We're actually going to have online, we're going to have how you could actually make those classifications. So I'll give you a brief rundown. For example, for detoxification purposes, if someone's been using for the last 2 weeks, more days than not, which means 4 to 5 days, drinking 6, 12-pack, or taking volume pill on a daily basis every other day, typically that means after a while the body develops a dependency, and the body kind of needs to continue. And so what happens, typically those individuals will require for them to go through some type of detoxification, so that way they can manage the physical withdrawals that come along, the trembling, maybe the sweating, just all the things that come along with this. And then we have residential individuals, for individuals that actually have a long history of drug using, and outpatient hasn't been very successful for them, or they could also have severe functional impairments, for example, difficult with conflicts, relationship, keeping a job. So they have a longer history. Typically, these individuals have a good established addiction for maybe, because it usually takes like 6 months for addiction. Maybe they have a few years, 6 months, and that's who will call for residential. Just to put it in a version where it's kind of understandable. But once again, I do encourage you, if you really want to know about what level your family member needs, is give us a call. Because that's the best way, because we're trained professionals. We're going to ask you certain questions that maybe you didn't even think of, and you're going to give us information we may even maybe weren't even aware of asking.
Right.
So I think a combined effort will give you the best answer.
All right, well, there you go. If you want a more detailed response or answer to your question and what level of care either you or your loved one needs, just call Crossroads Recovery Centers direct, and one of the qualified professionals there will lead you in the right direction. Edgar, I also wanted to talk about the other levels of care. I know we've only kind of touched the surface with residential treatment. So you also offer IOP and enhanced IOP, is it?
Yes, IOP, okay. I'm sorry about that. We use some of the IOP lingo and
right, not everybody's
not everyone
familiar.
knows the word. So I'll explain to you. So, for example, we already talked about detox and residential that we provide. Now, the other level of care is called day treatment. And day treatment typically is, think of this Monday through Friday, and then Monday, Wednesday, Friday, or Monday through Friday, 3 hours a day. And then they do meetings in the evening. So for day treatment, they could live on their own, or they could live in one of the sober living homes. So what happens is, they'll live in their home, we pick them up, we take them to treatment, we drop them off. It's more of an independent living. So think of it of a very structured residential to a semi-structured environment, where, because we want them to start incorporating the skills they learn in residential into their daily living. And however, we know that if we pick them up, they'll show up to meeting. Especially there's been situations where we go to the house and they're not up. And if someone doesn't show up, they probably wouldn't go to treatment. So with us, we pick them up, they get there, they get what they need, and they actually out there are like, I'm glad that I came. Because sometimes if they follow that initial response, they won't show up. And that's very important. That's the day treatment. And then we move down.
I'm sorry, day treatment, is that the same as IOP?
No, it's different. Because we have it's a partial day treatment.
Okay.
And that's considered day treatment. That's for the individuals that don't really fit the residential, but are not ready to be on their own, only attend twice a week, so they need that every day. But at the same time, they may be working full-time or part-time, and they need more extra level of care. That's how those individuals fit into that criteria.
I see.
And usually the day treatment is usually for 2 weeks to a month, and then they drop down to what we call intensive outpatient services. Intensive means that they're doing at least 9 hours a day.
A day?
A day, yeah. A week. 9 hours a week. Oh, people will be mad at me. Was that from residential all the way down? No, so it's IOP. It's 9 hours a week. So think of the day treatment. They're in the morning from 9 sometimes to 12, 1 or 2. And then IOP is 3 times a week. Or sometimes, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, depending on the days. Typically they do 3 hours every time. So that's how you're kind of working with those individuals. And then we have what you mentioned is enhanced IOP is same thing as day treatment. We'll pick them up, we'll take them, provide them food. That way they're focused a little bit more. But the goal is to transition a little of dependency on us, more develop interdependency, and then continue to that process.
That makes sense. So there's day treatment, and then you have enhanced IOP, and then you have IOP.
Yes.
So the enhanced IOP is they're actually living in the sober living home and a sober living environment. Okay, so, and you talked about them being able to have a work schedule, so they kind of pretty much lead a normal life. It's almost just like having, I don't know, please correct me if I'm wrong, but it's kind of like having a part-time job almost, but that job is being focused on your recovery process?
Yes.
Is that fair to say?
Yes, good. I like that. It actually is your part-time job and anything else. And what happens, then the other one we have is it's individualized outpatient, which is for the individuals that might need a little bit tune-up here and there. They come in once a week, or one individual, one group, and they're getting the individualized care that they need. They might have someone that's just in the beginning stages of developing a problem with alcohol or drugs, and then what we do is we do the evaluation and we say, okay, this individual doesn't really fit into these criteria, but if we know he's at high or she's at high risk of developing an addiction, so we customize a treatment that addresses those concerns.
That's interesting. That's interesting. So for the outpatient center, now is that actually located at the same place the residential is? Is that in Whittier, or where is the outpatient held at?
That's a good question. Actually, the outpatient is in La Habra. And so there was Distribution Treatment Center and Detox in Whittier, and then the La Habra is outpatient. And that's what we do, the family education, that's what we do, the individual therapy for people that are not part of residential. So think of it this way. Residential, they live there, and then everything else, day treatment, the outpatient services are all in La Habra.
Okay. So most of the, except for detox and residential treatment, everything is in the La Habra Crossroads Recovery Centers facility.
For now, and then we're actually opening them soon. We're opening up a facility in Big Bear.
Oh, how exciting.
Yes.
How exciting. Sounds nice and peaceful too out there.
Yes, it is.
There you go. So as far as the family program, you mentioned the family program, so that's kind of something different that I haven't heard with different recovery or programs or centers. So can you tell me a little bit about the family program and what it entails?
The family program, it typically entails anywhere between 1 session to 12 sessions of family education support. And what that does for those individuals is provide them an ability to work out some of the concerns family has towards their recovery, repair some relationships, learn some skills. So it's kind of what we're teaching them. And it's very customized. I could have a client that maybe only does 3 family sessions versus someone that does 12 to 15. You know, I would like to tell you I know how many sessions it's going to take for a family. I don't. So I'm thinking for a family, it's definitely 12 weeks. So they have a lot of stuff they have to work through. And that's the family that only needs 34 sessions because they put a lot of time and commitment to actually putting the behaviors and changing into place. And I have some family members are like, 3 sessions, and those would take 8 or 9 sessions, even longer. So we use the matrix model, which is evidence-based practice of giving the family education, support, the encouragement that they need in order to actually be able to live with someone in sobriety, and also the harsh reality that how the brains is affected by the drug usage, and then also how they're going to have to adapt and change to be able to live with this individual coming home, and what to expect and what it's unrealistic for this individual to kind of do. So the families you don't have to have someone in our treatment center to be part of a family program. You can come on your own, get the education, and learn. It doesn't mean brother, sister. It can mean anyone that they think is going to support their recovery process. So they don't have to have a conflict with them. They just have to have the desire to want to be part of their family and part of the recovery program. That's when we look at the family program.
Okay. So is it fair to say that the family program really you customize for each individual, and then anybody could be included in that family dynamic, related or not, but they want to improve that individual's life and help them through the recovery process?
Yes, definitely individualized. I mean, we've learned that if we give them a cookie cutter approach, it's not going to be very effective. So say I have this curriculum, and I'm looking at the family after the evaluation assessment, I'm not going to give them the whole curriculum if it's not needed. I offer the whole curriculum to them, and I say, this is what I believe, this is really going to help you. But I would recommend the whole curriculum, but if they only want 3 or 4 sessions, that's all I give them. However, I understand that, say a family hasn't had anything with trauma, I'll give them maybe a brief education, but I'm not going to go through the whole curriculum with that particular aspect because it's not part of their problem.
Okay, that makes sense. So I would imagine that a lot of the times the family members or people that are close to them get really affected by their addiction, regardless of whether it's drugs, alcohol, or what have you. So I'm assuming that during that family program you address those kind of what went on or how they were hurt, or Do you help the family itself and not just that individual person, I guess is my question.
We help the family. We help the family understand what addiction is. A lot of individuals have this belief that, okay, if I have my son or my daughter or my husband or my wife, if she learns the coping skills, if she learns what addiction is, if she, what we call core issues, trauma, stuff like that, or depression, then they won't use anymore. That's a myth. The studies have shown recently, in the last 5 years or so, or even a little bit longer, maybe 7 or 8, that the brain changes significantly. It's no longer the brain that once had before using. The reward pathway has changed to adapt to it. So the person might have a craving and have no control over that. So it's educating the family. So when it comes to with the family, is giving them the ability to understand what addiction is, what is an addiction, healing also themselves, recommending maybe individual therapy for themselves if the family can't handle that or can't give them the services they provide or they need. So that's one thing you have to look at is the first step is education, what to expect in recovery, what to expect the first 30 days, the first 2 weeks, the first 60, 90, through the whole process. So it gives them the tools how to deal with conflict. It gives them the tools how to deal with their own turns of guilt, shame, because the family also goes through a lot of stuff. And sometimes some family members are contributing to the problem. They have their own codependencies, so they actually need the person addicted to continue to maintain. And have some family members that say, "Man, it was easier when he was using." So the family gets used to being a certain way. So we have to change the dynamic, and also it's a very fine dance, so we have to let them know it seems what you're doing is contributing to the problem. Because the identified person is that person that is addicted. And we don't really look, sometimes we don't look at that, oh, maybe this family member is not that healthy for this person. There's sometimes I have to say to the family member, sorry, you're not ready to do family therapy or family education because you're just not there yet. Because there's so much anger, so aggression, resentment towards the individual that it's unhealthy at that moment.
Right, it's not helping.
So we do help the family by giving them the skills, understanding, normalizing, or giving them awareness that this is normal. You are where you're supposed to be, given the stages where your family member is, and this is your own stage of your own family. So the families also go through stages, and it's a general terms, but it gives them at least a rough understanding of where they have to go and where we want to lead them to.
That's great. That's great. There you go, the family program. So for anyone that is looking to improve that family dynamic, suffering from any kind of addiction, their family members themselves or the individuals that are addicted, right? And that's correct. If a family member wants to go in by themselves without that individual that's addicted, you can also assist them with how to help that individual push them towards recovery?
Yes, so we give you the skills to be able to assist you in influencing someone to come into treatment.
Right.
And so that's what we're doing. Where sometimes we'll get a call, my family member, my son is going to come in treatment. So sometimes we just have to tell the family member how to cope with someone like this and how to encourage them to come in a way that is not coercive or threatening, because you're really not going to get that much. So it's a different type of approach that we kind of teach the family members to stop coerciveness and be more supportive and understanding. But that's difficult to do, because if it's intuitive, it seems like the wrong thing to do, because it seems like, am I just accepting this? Am I just saying it's okay?
Just throwing your hands down and saying, hey, that's just is what it is kind of thing?
Yes, but the skills that we teach them are very specific. It's kind of like a guided approach where you stop coercing and try to understand the relationship they have with this and how important this is. And because with the addiction, with the drug, it's a relationship. It's something that you do with someone. They live in your brain. They provide you comfort. They provide you healing. They provide you some form of feeling pleasure, feeling good, and that's a relationship. And sometimes some people cry over their drug. They grieve over the loss of this, and because it has a very powerful impact in our brain. And the family members, when they come in, they will learn about that with us.
That's interesting. I love that you guys really kind of hit every aspect. So you're helping the individual, you're helping the family, or friends that were affected, you're helping heal them, you're helping to improve the life of the individual with their addiction. Really all around great program. So you also mentioned that adolescents, so adolescents, do you offer every level of care with them as well?
No, we offer with level care we offer them is day treatment and intensive outpatient services. Residential, not at this moment. So if we have teenagers coming in every day of the week, usually from 9 in the morning to maybe 1 o'clock, or 2 o'clock, and they do individual sessions. So they're very busy in the evening. We expect them to do some meetings. So they're constantly doing something for their recovery.
That's amazing. So then the residential location is for men and women, adults, or?
Yes, the residential is for men and women 18 or older.
18 and over.
Mhm.
Okay.
Yes.
Okay, terrific. And then your outpatient program, so who qualifies for outpatient care? Is that, because you just have therapy, so that's couples therapy, family therapy, or what is that?
If you have a heartbeat and you want services, that you qualify.
There you go.
I know, but in all
like that.
seriousness, is if you have a desire to want to improve your life, if you are struggling with either sadness, depression, some addiction, trauma, anger, we could help you. Whether you are 5 years old and you're 65, 70, 80 years old. I believe the oldest client we have right now is up in their 80s. So it varies, and the youngest person that's being helped through us, I believe was 8 years old. So there's a huge range of individuals at this moment that are providing the services that we offer.
That's terrific. So you provide child therapy then too for little kids all the way up to however old you are. So that's individual therapy, family therapy, and couples therapy?
Yes, we provide
everything under the
We
sun?
provide all those. And think about the program this way, is that if we have family members if we have clients that family members need some disc therapy, we could offer those to them. So we could enhance that by seeing the family, because if we are seeing our clients, seeing their family members, and then we see their other family members, it really gives a good understanding of the whole dynamic of the family,
Right.
what takes place. And I think that's a really great thing, where in one place you could get everything. And sometimes I understand, sometimes family members would rather go somewhere else, and that's okay too, as long as they're getting some help. So if they don't want to come with us, I encourage them to go somewhere else, which is to get the help. So if not with us, with anyone else. That's the main thing.
That's great. So your outpatient staff, is that the same staff that you have at the residential facility?
No, it's different. There is 2 or 3 staff members that come in part-time, but most of them, we try to keep them separate.
Okay.
So when they transition over, the reason we want to keep some of them is because when they transition over from residential to day treatment, they already have a familiar face, someone they're aware of, they've been talking to before. So it's not a whole new environment where they have to start anew. They already have some familiar faces, and that helps out with the transition. We call that the warm kind of handoff, where they
Okay.
know someone. It makes it easier for treatment.
That makes sense. That makes sense. Okay, so so you really offer everything under the sun, from outpatient to IOP to residential, and you have a variety of staff. Can you tell me about their specializations though at the outpatient? Because you got into it a little bit for residential, but not so much at the outpatient.
For outpatient, we have anger management specialists, we have alcohol and drug specialists, we have individuals that focus on trauma, individuals that focus on with children. So it's a variety. For example, we have some clinicians, including myself, that were trained in evidence-based practices, which means the therapy that we do has been verified by research, that it's effective to treat depression, anxiety, trauma, co-occurring disorders, trauma, and substance abuse. So we attempt to give them the best we can, what the research says is going to be helpful for them.
Sounds good. Sounds good. And Edgar, so you're the executive director at Crossroads Recovery Center and the Residential Treatment Center, is that correct?
Yes.
Can you give me a little bit about your background and how you got into working with addiction?
Sure. This field, it was the last thing in my mind. It wasn't like I said, when I'm little, I want to be a therapist
Right.
or an addiction counselor. It was far beyond mine. However, I've been touched by the addiction process, family members and whatnot. So it was something I wanted to stay away from. So it's not something I was running towards too. I was the men's organization. There was an alumni there that wanted to hire someone at a halfway home. I took a graveyard shift, and then all of a sudden, me being working there, they wanted me to do Toastmasters. And so I went into Toastmasters, and I did a speech, and that's how I met my mentor. And he kind of got me through this process, and I was still stubborn. I want to do something else, but for some reason, destiny, or however you want to call it, or higher power, however you want to look at it, kept guiding me back to the same direction. It's like, no, I got a different plan for you. So it kept getting me back, and then I realized a lot of things about myself, took some courses, got my credential for certified counselor, went and got my master's, and then did different trainings and all over the place. He would take me to different trainings to meet different people, and that's how kind of people would look at it and say, I just fell into it. But now as I'm getting older, I'm realizing it wasn't just it fell into place. This is where I kind of was supposed to head.
Your
anyways.
divine intervention was kind of
My
pushing
divine
you
intervention went
towards
this way.
that.
And the way I come to Crossroads was kind of the same way. I wasn't looking for a job. I actually wasn't looking for anything. I'm busy as it is, and it just happened to me. Something told me in my head, I call it whatever you want to name, is it's turn around, go in there. And it wasn't just like go turn around. It was kind of like this feeling, like this urge to do it, which is different from like, I'll do it later. But it was this urge, and I did a U-turn, which I think it was illegal U-turn too. Now that I think about it,
Let's not share that.
That's true. And then I met my business partner, the co-owner, Marcos. And then that's how I got involved, and that's where I'm here now. And I've evolved from residential to now detox, and so that's kind of how this worked out for me. It wasn't like I'm gonna want a treatment center. No, it was just that's how I'm here. I really enjoy it, and I think I'm privileged to be able to be a part of this. I think that my ability to talk to people, it's something that I've been told that it's good, and it feels really good. It feels really warm. You look forward to it. You get energy, and it's just some of the things that I can't describe to you. It's just this calmness that comes along as you're doing this type of work, and amidst all the turmoil, the rainy storm, and yoga they call that, kind of through the storm and remaining calm. It's kind of like that. It's just interesting how this all has worked out, and I would have to say that I am privileged to do this, and I can't see myself doing anything else besides this.
That's terrific that you're just improving so many lives, you and your staff, by helping assist them and guide them in the right direction. That's amazing. So I think they're privileged to have you as well.
Well, one thing I look at is someone gave me these gifts. We all have gifts. And one thing you learn at our treatment center is that every client, every individual has their own potential, their own gifts. And if you could unlock them for them so you could see them. I had a client this actually morning, 8 o'clock in the morning, and this client compares himself to success and whatnot. And until he sees his value, until he sees how wonderful, how much he has to offer, it is just, and that's one thing we try to do at Crossroads, is every person is very valuable. Every individual has something to give more and greater than themselves, and when they realize that, when they become greater than themselves, when they go beyond there, and we call that transcendence, and so we'll have this awakening in themselves, and they connect. I think that's the beautiful thing about all this. I think that's when everything kind of clicks. And I think that's the part that I really look forward to, is just when it just clicks and they realize that, I'm more than just who I am. I'm just more than just drug. I'm part of something greater. And that's what we try to offer at Crossroads. You be part of something greater than yourself and give, because if you give it, you could always get it back. You can never give what you don't have. And as you give more, you get more. And I think that's something we try to teach at Crossroads, is give yourself to this process.
Right.
Yeah.
That's amazing. So I just feel kind of your energy and excitement and really genuine care for kind of the individuals and what you do. Mm-hmm. Is that kind of the same philosophy that everyone at Crossroads holds, or can you tell me a little bit about kind of the dynamic between your staff and what you guys all really believe in?
Well, one of the things I look at in a staff member is compassion, because you can't really teach that. You can't really teach compassion and empathy. I mean, you could learn it, but we could teach skills, we could teach all these different things, but in order to have compassion and empathy, those are innate traits that I'm looking for in our counselors and our therapists. Imagine this: you've suffered addiction for a very long time. You feel misunderstood. You feel like no one knows you. You walk into an environment and someone's empathetic, understanding, accepts you, embraces you. That's already a warm feeling. And we need something like that to be able to combat the addiction, because addiction is very strong. It doesn't want to leave you alone. It wants to keeps a hold of you. And if you go into an environment where they don't offer that, they don't care, it just is going to validate that addiction says, see, no one really cares. This is not the point. So that's one thing we're looking at. So you come to Crossroads Recovery, we're going to make sure that you have someone that's going to embrace you, is going to accept you unconditionally for what you've done or what you haven't done, and provide you that care that sometimes then we need in those moments when we're down. And there's an interesting saying that my mentor just says, love yourself when you leave the service because you need it the most. So apply that to an individual. Love others when they leave the service because that's when they need it the most. And that's what we try to do at Crossroads. We try to provide you as much love as we can to be able to combat or at least have a chance to be able to recover from this. And it is possible to recover. And this is a lifelong process. This is not just 36 days. This is something you do forever. This is like you compare a medical illness. You don't say, okay, you're cured from diabetes or you're cured from a heart problem. They're going to monitor you for the rest of your life because it requires the same thing with addiction. And that's what we want to make sure that this is a lifelong process, that it's a lifestyle.
Right.
You know, it's not a place, it's a lifestyle that you have to do.
That's amazing. So Edgar, you mentioned that you can recover and you can overcome this. So can you tell me too, how long, what's the longest that someone that you know has recovered that they've been using?
Well, for example, we have some staff that have been in recovery for 15, 20, 25 years. And I mean, so it varies. And we have, clients that are in the beginning stages. Some of them have a year, because our facility is young. Our facility is young. We've only been established July of last year. Okay, so we have clients that are sober for a year, coming up to a year. And so but in other places where we've been able to work, we know clients or individuals that are sustained for a very long time.
Terrific. So Edgar, before I kind of recap all your levels of care, is there anything else that you'd like to share about Crossroads specifically, or as broad as you'd like to be?
Yeah, one thing I do want to share is they asked me, how much does this cost?
That's important.
That's very important. That's one of I think the second or first question I get asked, how much is the services?
Right.
It varies. It varies for individual. We accept private insurance, so that would cover everything for you. And sometimes you have out-of-pocket costs, which it varies for everyone. Sometimes it could be, sometimes we take clients in for free. We do a pro bono case. Sometimes we'll charge someone that it could be anywhere between $8,000 to $10,000, and actually is pretty. People say $8,000 to $10,000. That's a lot of money. However, if you compare all the stuff you're going to get for that compared to other agencies, it's actually lower than most places.
And that's the residential treatment that you're referring to.
The other one could be customized depending on the meetings you're doing, depending on the session, depending on the testing. It could be all customized, and we do use sliding scale. We use different things or tools that could help us provide services in an affordable, cost-effective way where you receive these services and at the same time you feel good about what you're paying. You're getting what you're paying, even much more. So that's one of the questions that we get. If you have a family member, if you have someone that is suffering, that has been in and out of treatment, and you need something new, something different, I recommend call Crossroads. And it's not going to hurt, get more information. Or if you yourself, you're a family member that's struggling with someone with addiction, give us a call. We could help you, we could assist you, we could encourage you. Sometimes you need someone just to listen to you, beyond your family member, someone that is totally out of the picture and give you some education and support in this process. And because one thing we want to advocate for members is have your life. Don't be your life revolving about this particular with addiction, because it's really, really easy to fall into thinking all about the person that is addicted and kind of losing your life. I've met a lot of family members that they're so consumed about this, and rightly so. And just give us a call if you need any type of services. If you need some linkage to other services, you don't have to come to us. The big idea I want to say is just get some help wherever it's at. If it's with us, with someone else, I encourage you to get the support. If it's somewhere you need somewhere to live near your close, give us a call. We'll link you to somewhere else near to you. We'll give you a recommendation of different therapists that we've worked along with, that we know. So I really encourage you just to fight that thought that says, I'll call tomorrow, and just call today.
There you go. Why wait, right?
Why wait?
Recovery starts today. I like that. Well, Edgar, so if I can just recap, you have a residential facility, residential treatment, which is the individuals will reside there and have everything taken care of them, from cooking and cleaning to providing them with the amenities that they need in a nice, serene, sequestered environment with a pool and beautiful setting while they receive their therapy.
Yes.
And then you also have Detox, which is for individuals that have been using for whatever length of time that require to go through the detox treatment. And you also have a step down from residential is your day treatment, and intensive outpatient, and enhanced IOP, which is an enhanced outpatient, where they actually reside in the facility with a sober living environment. And then you also have outpatient, where they attend their groups or meetings, and then you have your outpatient for everyone really that wants therapy, correct? From children's to adults to couples to families and kind of everything under the sun.
Yes.
So
You did a great job listening.
I try sometimes. No, but in all seriousness, you really reach out to everyone, and I feel like anyone can be assisted by either you or your staff, and what you guys are offering them is really amazing and wonderful. And I thank you for taking the time to really tell us a little bit more about Crossroads Recovery Centers and all that you offer.
Thank you very much for having me today. Appreciate it.
There you go. Have a great night, everyone.